Hi folks, this is John Adamson, the Rehab Documentation Guru, and you might notice I've clean shaven, and I'm actually sitting in my car in the rain waiting to pick up an Uber rider. I do Uber on the side, just a little bit of everything. As some of you know, I have a large family. And anyway, I'm doing a video, I should say, on an email that I received from a former participant in one of my courses. And here's the gist. Patient had a rotator cuff surgery. Didn't really start full rehab until about 12 weeks post-surgically, but went through therapy for about 3 weeks. At that point, the therapist thought the patient had really maxed out on their strength gains, but functionally they still had some functional issues. Went back to the orthopedist, and the orthopedist wanted the patient to continue 1 time a week for 8 weeks, whereas the therapist thought it might be more beneficial for the patient to come 2 times a week for 4 weeks. So her question, or the therapist's question, was, would that necessarily make it so that Medicare would consider it maintenance therapy if they're 1 time a week? The frequency per week really should not have any bearing whatsoever on maintenance therapy, or whether it's considered restorative therapy or rehabilitation or habilitation, whatever terms you want to use. Frequency per week has nothing to do with it. Can your goals be achieved, whether they are rehabilitative, habilitative, maintenance, if the patient's being seen 3 days a week, 2 days a week, 1 day a week, every other week? Because let's say you're seeing the patient 1 day a week. Strengthening will not occur on an evidence-based perspective once a week. There are some bodybuilders that will so exhaust their muscle groups that they will literally only exercise that body part once a week. But they're doing like 50 and 60 sets, and they're totally wiping that muscle out. We don't exercise our patients that way, and most normal human beings who are not taking some performance-enhancing drugs cannot tolerate exercising that much to the point of total failure where once a week is sufficient. So the question then becomes, is once a week effective, skilled therapy that's non-maintenance in nature? And the answer is it could very well be, because what you could be doing that once a week is you could be upping the patient's program. So they come in once a week, you evaluate where they are strength-wise, functionally, take some measurements. You determine that, let's say, 4 out of the 5 exercises you've got them on are working, but 1 is not as effective as it could be. You up sets and reps. You maybe alter some exercises. That's your skill. But your goals are still going to be rehabilitative. You're still rehabilitating the patient. So you see them in another week, and then you reassess and you up their program again. The frequency has nothing to do with it. And if a Medicare auditor, let's say, decides to deny your case, saying that once a week should be sufficient for them to carry out their own program, to be maintained, whatever they're saying, you can just point them to the fact that your goals are still rehabilitative, and the skill that's going on that once a week perspective, that you are assessing and adjusting and modifying their program that a non-skilled person could not do for that same patient. So again, it does not matter, or it should not. And if you're getting denials because of frequency, that's a problem with the reviewer, and you can easily appeal those kind of decisions because they're not clinically based. You're the clinician. You can make an argument for that 1 time a week if you need to. Anyway, thanks for watching. This is John Adamson, the Rehab Documentation Guru, coming to you live from Richmond International Airport, where I'm Ubering as well, and I hope you have a great day.